It's an ailment millions are living with, and we may be learning something new about it. Chronic inflammation is characterized by symptoms like fatigue, muscle ache, and headaches. It's also been linked to cancer, type 2 diabetes, high blood pressure, heart disease, and stroke. New research suggests it could also be affecting people's mental and cognitive health. Best-selling author and CBS News contributor Dr. Mark Hyman is here this morning to talk more about it. Good morning. Good to see you.
Good morning. Good to see you.
So you've called chronic inflammation a hidden fire in our bodies. So what exactly is it, and what causes it?
Well, our bodies are affecting our brain, and mental health is really coming from what's happening inside the rest of our system. And our diet, our lifestyle, lack of exercise, our ultra-processed food, the amount of sugar we're eating, stress we're having, the lack of sleep, all those are driving inflammation. And it doesn't just affect your body, it affects your brain. And it doesn't show up as a sore joint, it shows up as depression or anxiety or bipolar disease or more severe problems. And so we actually know the linkage now between our inflammatory lifestyle and inflammation in the brain and depression. And you can actually treat it by addressing the inflammation, and you can actually test to see if you're inflamed.
Is there a difference between men and women in terms of inflammation?
Yes.
Does one get it more than the other?
There is, and we know women tend to get more autoimmune disease, more inflammatory diseases, more Alzheimer's. So there is a linkage. It has to do with the X chromosome. The data is still sort of emerging on how that works, but there definitely is a higher linkage of inflammation in women.
So if you want to combat this, you say it's the foods that we eat.
Yeah.
Right? Should we be avoiding? What should we lean into here?
Well, the first thing is
You're going to say no cupcakes.
You want to test.
Kill my joy.
No hot dogs.
Yeah.
You want to test what's going on because people don't know what's happening in their bodies. They don't know they have insulin resistance or prediabetes, which is affecting half of Americans. They don't know they have vitamin D deficiency or omega-3 deficiencies. Inflammation levels are high. We see that in Function Health, a company I co-founded with over 46% with high inflammation. So people are inflamed. They need to know what's going on. Second, they need to look at their lifestyle. Diet is the biggest factor. So we're eating an inflammatory diet, 60% ultra-processed food, lots of sugar, lots of starch, low fiber, low plants. I mean, we're just not eating a diet that's anti-inflammatory. So we want to move towards that, which is a diet that's rich in whole foods, it's rich in omega-3 fats from wild fatty fish, it's rich in lots of colorful plants, it has lots of fiber, fermented foods. All those change your inflammation levels, particularly your microbiome, because you're feeding not just you, you're feeding this whole environment of bugs in your gut, and that's driving tons of inflammation. So there's a lot of ways to fix it, and so exercise fixes it, sleep fixes it.
But you said diet is the most important thing, more important than exercise and sleep, because I keep hearing more and more about sleep.
Yeah, sleep is important, Gayle, you know that. but diet is the biggest driver of inflammation in our society, and that's why we're seeing such a, like you mentioned at the top of the show, heart disease, cancer, diabetes, Alzheimer's. These are all inflammatory problems, including mental health, and people don't make that connection. So that's why this is so important. People understand people are depressed or they're anxious, or they have more serious mental illnesses like, for example, schizophrenia or even bipolar disease. People at Stanford and Harvard are now studying these dietary interventions, which are showing dramatic effects in actually reversing these chronic problems in mental health.
You know, it's not something you feel, right? In other words,
no, you don't feel it. You
don't feel inflamed.
Yeah.
So how does a doctor test for it?
Well, in other words, your brain is inflamed. It doesn't hurt because, like, your brain doesn't have pain receptors.
Right.
So
it's not like sciatica.
No. So I co-founded a company called Function Health, and we do expensive testing looking at C-reactive protein, an inflammation marker, looking at omega-3 fats. About 90% of Americans are lower or insufficient levels of omega-3s, which are very anti-inflammatory. We look at things like the insulin resistance, which is prediabetes. We can measure insulin. We can measure your blood sugar, hemoglobin A1C, other factors that drive the problem. So it's a metabolic problem. There's a whole department of metabolic psychiatry at Stanford that studies the metabolic problem in the brain that comes from our diet.
Yeah, but to Vlad's point, you don't feel it, so you have to get diagnosed by a doctor.
That's right. Yes, you can just, the testing is important and the diagnosis is important, yeah.